Hi, I'm Dr. Gerry Spindel, welcoming you to Ion Health. I'm an ophthalmologist in Derry, New Hampshire, and as always, we bring you many of our local healthcare experts to help you deal with many of the common clinical problems that you may be facing at home. Today, our guest is a chiropractor from Derry, New Hampshire, Dr. Phil Szalowski, who practices at Broadway Chiropractic in Derry, New Hampshire. If you have questions for Dr. Phil, as he likes to be called, you may send them to him through our office at Spindel Eye Associates, 6 Sheena Road, Derry, New Hampshire, 03038, or on our website, www.spindeli.com. Dr. Szalowski also has a website which I'll give you, which is www.broadway-chiro.com. I'm sure he'd be happy to answer questions there as well. I want to welcome Dr. Phil. Thank you for joining us.
No problem. Thanks for having me.
So I told you that my brother's a chiropractor, so he retired chiropractor, so I'm somewhat familiar with that field, but I know that things are always changing, so here you're going to help us stay up to date with our viewers on the latest developments in chiropractic medicine. So tell us a little bit about what exactly a chiropractor does, and then we'll maybe talk about your education a little bit also as well.
Sure. A chiropractor basically focuses on the overall health and wellness of your spine and nervous system. That's kind of our nuts and bolts of what we do. We try to make sure that the spine is functioning properly so that the nervous system can regulate the rest of the function of the body properly. That being said, we see a lot of people for some of your basic, neck pain, back pain, headaches, those types of things. That's what usually people present with, but from there we try to make sure we're looking at the body as a whole and treating the person as a whole instead of just breaking it down system by system. So
not always is it necessary for somebody to have a car accident or throw their back out to come to you, or do people come to you for preventive care for their skeletal, musculoskeletal, nervous system?
Yeah, we actually have both kinds of patients. We have some patients that come in just on a pain-based basis, and then we have some patients that come in more on a preventative or overall wellness basis, trying to make sure that everything stays functioning well instead of waiting for it to break down and coming in.
So I understand that your wife Jessica is also a chiropractor?
Yes. Yeah.
She gave you time out of the office to come here?
She did. She let me off the hook for a little bit. Yeah.
And you also have a 2-year-old, is a daughter?
Yes. Yep.
Great, wonderful. So you've been in Derry now, how many years?
4 years.
4 years.
Moved here in February of 2008 and opened our office in July of 2008.
That's very brave of you in this this healthcare environment.
Yeah, it wasn't the best timing for opening an office, but it worked out pretty good.
You're doing okay.
Yeah.
Well, it's good to have you in Derry. So you went to chiropractic college in New York. Tell us a little bit about that and what a chiropractic college is and what you do there.
Sure. Before you go to chiropractic college, of course, you do your undergraduate degree. I actually
4 years of college.
Yeah, 4 years of college. I actually went for pre-chiropractic, just like you'd go for pre-med. And then you go on to chiropractic college, and what you do there is basically, it's 10 semesters worth of coursework. So it's basically 5 years worth of coursework that you kind of jam into 3.5 years. So you go year round. A lot of anatomy and physiology, but all your other stuff too, microbiology, and a lot of time spent on chiropractic techniques, and it's pretty intensive when you're going through school.
What are the different techniques that a chiropractor would use? I know that some chiropractors favor different techniques, and they have their favorite.
Yeah, that's where the art.
Give us a little rundown.
Yeah, there's so many out there. That's where the art of chiropractic kind of comes in. Everybody has their own preference as to what they use, and it ranges from techniques that use mostly a hands-on approach, where you're actually moving the patient and trying to adjust areas that aren't moving properly or out of alignment, up to low non-force techniques that work more on general tone of the nervous system and the muscles, and making sure that there isn't too much tension in one area or the other. And then you have your instrument-assisted techniques that use different kinds of adjusting equipment to help, again, achieve the same goal, which is to restore normal mobility and function and alignment to the spine.
How did you become interested in becoming a chiropractor?
It's kind of a random story. I actually didn't know what a chiropractor did. When I was in high school, you were supposed to pick your, where you go to, what you do when you grow up. And I went to the guidance counselor's office, opened up a little one of those career handbooks that was about 2 inches thick, and was flipping through the pages, and I landed on a page that basically summed up chiropractic. And I always wanted to do something in the healthcare field, but I wasn't sure what. And when I read the description, you know, basically treats the body without the use of drugs and surgery, hands-on approach. It sounded great to me. You know, I wanted to deal with people, and for me, I just knew that that was more the direction I wanted to go versus some of the more invasive stuff that you would find with mainstream medicine.
Were you a big-time athlete or anything before you went into this?
I
know
played,
a lot of chiropractors tend to be athletic.
Yeah, that's true. I played a lot of volleyball. That was my sport, but you know, I'm not as athletic as some of those rugby guys and stuff that you see at Palmer, where your brother went to school.
Okay, interesting. My brother was a college scholarship basketball player also.
Oh, basketball?
Yeah, so it seems that kind of runs through the whole thing, doesn't it? So then you've done, I think you did some other work, some internships and specialty work in your education where you were an intern at some point, and you worked in the VA, I think, a little bit. Tell us about some of the other chiropractic experience you had before you went into private practice.
Sure.
Further your education.
Yeah, that's actually the last year of our schooling is basically spent doing rotations in different clinic settings. So that was, you know, I went to the VA, I went to a couple hospitals in the Rochester, New York area, did a lot of athletic competitions. So it was a really wide range of patients that you got exposed to, which was really nice, you know, coming out of school. And even while you're going through college, we actually spent a lot of time on extra seminars, whether it was weekend seminars or during breaks, whether you take a couple seminars on different kinds of techniques and things you can utilize to help patient treatment.
Cool. And what is the difference between an osteopath and a chiropractor? I know that's osteopaths is an older term also, right? What's the difference there in the philosophy of how they treat patients, or their schooling, I should say?
Yeah, the doctor of osteopathy is basically, they still do some manipulation, they still do some hands-on stuff, but a lot of them, they have a lot more training as far as pharmaceuticals go and prescribing, and that's really the biggest difference, is that they deal more with prescription medications, where we deal solely hands-on approach. A lot of doctors of osteopathy are actually primary care physicians for their doctors. They're kind of like the go-to guy for their patients. So.
Okay, so it sounds from the talks that we had before this our interview that the new wave of chiropractic is more of a whole body type of treatment, and different from, I think, what we grew up with, where the chiropractor just took care of the car injury patient and things like that. So what is your definition of health, and how does that feed into what a modern day, and sorry if it's not insulting if I call you a modern day chiropractor.
Oh, that's okay, that's fine.
You're so young, you know.
Yeah.
So
That's okay.
there's no question that it seems like the field has evolved.
Yeah, it is slowly changing. Chiropractic was basically founded on the principle that the body is self-healing and self-regulating. We've kind of gotten away from that as a society. We tend to look at healing now from the outside in instead of the inside out. You know, we look at needing something to make us better instead of waiting for our body to take care of a problem on its own, or giving it the right tools to take care of problems on its own. And we're basically going back to that way of thinking, or trying to focus more on that way of thinking instead of what I call chasing the pain, which for some patients, you know, that's all they want, and that's certainly what we can provide for them. But more and more people are kind of waking up and realizing that our health isn't where it should be as a nation, and there's a really good reason for that. It's because we don't take care of ourselves. And when you look at the nervous system, that's really what regulates and controls everything else. So if you don't have a healthy nervous system, it doesn't form a very good foundation for overall health. So our goal is to make sure that nervous system is functioning at 100%.
So really you're not focused on the bones and muscles, but you're focused on the nervous system, which controls the bones and muscles. Is that a fair thing?
Very good. It's a nerve-first approach. You know, the bones and muscles encase the nerves, so you have to, by nature, address those. But more importantly, you're trying to make sure that the nervous system is regulating everything else properly.
So how do you do that?
how do you assess for and see how things are working.
Yeah. Educate me.
Yeah.
I'm just an ophthalmologist.
Yeah.
About the rest of the body.
That's fine. So we, first things first, we do a lot of hands-on palpation. So that means touching and looking for areas that are either restricted in terms of mobility, not moving properly, or simply out of alignment. You know, if somebody has a scoliosis or forward head posture, which most of us do because we spend so much time on a computer. Those kinds of misalignments put a lot of stress on our nervous system, and those are the kinds of things we try to address. We also, you know, we'll use x-rays if we think x-rays are necessary to check for overall posture and alignment. We use some scanning equipment in our office, which we'll talk about a little bit. That's a whole separate topic that we can talk about. But we're basically assessing function rather than just where it hurts. You know, that's an important part of it, but you want to make sure that you're looking at the body as a whole.
Do you do anything with nerve stimulation? Well, I'm not sure how they do that. I know that they use nerve stimulation, some chiropractors, but I don't know if they use that anymore. Is that an older technique? Or?
It depends on, you know, it's funny because a lot of those techniques have been around for a while. Even some of the stuff that we use that seems new to our patients has been around for a while. It depends on what you've been exposed to.
Right.
So the adjustment itself is really, you're trying to stimulate nerve function that hasn't been that's been basically patterned in the wrong way. So if something's been out of alignment for a long time or hasn't been moving properly or you know, either of those two things, what we're trying to do is stimulate those nerves to kind of remind them where they're supposed to be, because your body falls into these patterns. You know, it starts to think that that's normal for you, and that's where the adjustment comes in. So there's different ways of doing that, and I'd have to see what specific technique you're talking about. But
no, just something I know that was my brother talked about. Yeah, that they used to do.
I'd love to talk to your brother actually at some point.
And where do you overlap or feed in with some of the Eastern type of therapies like acupuncture and chi energy and things like that? It sounds like I'm hearing a lot of the same kind of stuff.
Yeah, it's more similar to that than to our modern Western medicine. You know, and basically it's just breaking it down to a vitalistic or holistic approach where you're looking at the body as a whole instead of segment by segment or region by region, and vitalism, which is basically the body's innate nature to be able to heal itself if you give it the proper tools. Something I kind of mentioned before. So that's how it's very similar to. That's why it's hard to explain things like acupuncture and those kinds of things in the Western mind frame. You know.
Yeah. Yeah. So let's run through a typical patient. Comes in. What would be, you know, who came in today? Tell me about some patients that came in today and what you did for them.
All right. So can we go with yesterday?
You can go with yesterday, sure.
So yesterday I had one of the most common complaints we see is sciatic pain or leg pain. You know, it's just something that initially, some people come to us initially, but a lot of people have been through a lot of other things first that may or may not have worked temporarily, or and they kind of come to us as a last resort, and it's basically trying to, when they first sit down with us, trying to figure out, you know, what's going on, how long it's been going on. It's your basic consultation. You know, I just want to get to know how this is affecting you and how long it's been affecting you. So with sciatic pain, you know, some people have difficulty even getting out of bed or getting out of the car when they've been in the car for a long time. And those are the kinds of questions that I ask. You know, I'm trying to figure that out because, again, I'm trying to figure out how it's affecting your overall health and function. After the consultation, I go into the evaluation or the examination, where I do some chiropractic tests. I do some orthopedic and neurologic tests just to make sure I know what's going on a joint from a joint and a nerve standpoint. If I need x-rays, I take x-rays after that, and then I run those scans, which help us assess overall function again. After that, I like to sit down with everything and figure out what's going on, so I usually set up a follow-up visit to sit down with the patient, review all the findings from the evaluation, from the x-rays, from the scans, and come up with a plan. You know, figure out first of all, what's causing the problem. You know, with sciatic pain, there's a whole host of different issues that could be causing it. So you want to figure out what's causing it, and then you figure out a treatment plan for that person. That's usually where I sit down with people and kind of explain to them and ask them what approach they want to take. Do they want to take more of just a symptom-focused approach and just deal with this particular issue? Some people, that's all they want to do. Or do they want to do, after we've taken care of the symptom, do they want to try to address the cause and try to focus on more of a preventative or wellness kind of lifestyle care versus just waiting for the symptom to come back?
Yeah. Do you tend to do a lot of strengthening type things? Do you teach people certain exercises? Is that part of your
Great
therapy?
question. Yes.
Great question.
Yeah, that's actually something that's really important in our practice. We focus a lot on core exercise, core strength, posture, and balance. And I don't tend to add things right away. I might add some stretches right off the bat, but I like to make sure that things are moving properly before I start to strengthen them. And it doesn't take too long to get into that strengthening phase, but a lot of things I add are really basic things that you have to do every day. You know, I always compare it to like brushing your teeth for your spine. You know, it's a couple minutes a day, a couple times a day, but the key is the consistency. You know?
Right.
If I give people an hour's worth of exercises, only the most motivated people will keep up with that for any length of time.
Right.
Most people, they don't have the time to keep up with that. So I try to keep it simple. And if I get them to do those couple exercises a couple times a day for the rest of their lives, that's the goal.
Getting it moving.
Yeah, that's a big part of it though, because you got to do your homework. Otherwise, we're going to be running in circles.
Yeah. So what kind of behavioral modification things do you talk about? Like, you mentioned here about sleeping positions or things like that, posture, workstations. Talk to me about sleeping positions.
Yes.
Interesting that you see a lot of things advertised for sleeping positions.
Yeah, sleep. That's one of the, you think about how much time we spend sleeping.
Not enough sometimes, so yeah.
Good point.
Yeah.
But, as far as a percentage of our whole lifetime, we spend a lot of time in bed. And the position you take up in bed has a lot to do with how your body's going to function the rest of the day. One of the biggest things I try to get people away from is what I call stomach sleepers. When I hear that, I cringe because it's like a chiropractor's worst nightmare. When you're sleeping on your stomach, it actually puts your spine in a really bad place.
Flexed the wrong way.
Yeah, one thing, it's flexed the wrong way. You're not supporting the lower back, or the lumbar spine kind of sags.
Right.
And then you think about it, if you're lying face down, you have to keep your neck turned to be able to breathe, so you're not laying face into the pillow. And you think about how long you keep your neck turned all night like that, it's going to create a lot of asymmetries and a lot of tension in the spine. So I really try to get people away from that.
And then you probably try to get them on their side or on their back. What's the best?
Either one of those is fine. Side or back is fine, as long as they're not on their stomach. And usually the best way for me to try and change up that pattern is I try to get people to get one of those big long body pillows, those really long ones,
right.
And to basically use it as kind of a comfort thing. Yeah, you can put one in. That's another important thing, is when you're on your sides, you want to make sure that you sleep with something between your knees, kind of give you nice spacing for your hips. So one end of the long body pillow can be between the knees, the other end up between the arms, and it kind of gives you that feeling of comfort where you're not entirely on your stomach, but you still have that, something in front of you.
Support.
Yeah.
Yeah.
So that's one of the ways that I try to change people up on that.
How about for people who, a lot of people seem to have a lot of neck problems.
Yeah.
And they wake up in the mornings with stiff necks. Their neck could be stiff for 2 or 3 weeks. I mean, what is the biggest cause of people with these chronic, it's not like they've been in a whiplash or something like that. They just wake up and their neck is stiff all the time and they're just feeling lousy. Where does that come from? Are you just laying in bed? Why does that happen?
Yeah, a lot of factors play into that. I always break it down to there's basically 3 forms of stress that we go through day in and day out that cause problems like that to keep reoccurring. And it basically breaks down to physical stress, which is things like slips and falls, staying in the wrong position for too long in front of the computer, maybe sitting on the couch with your head slightly turned every night. Those are physical stressors. Another form of stress, the second form of stress, is biochemical stress. That boils down to either getting too much of something you shouldn't be having, whether it's diet or things we breathe in or whatever else, or not getting enough of something you should be having. So that's whether, again, it's diet or something else. And then the third form of stress is emotional or psychological stress. And that's usually, that's when people go, oh, yeah, ding, ding, ding. That's usually what really brings things to the surface, because when you talk about stress, that type of stress, we're kind of in a chronic state of stress all the time. There's always something to stress out about.
Sure.
And one of the basic stress responses is for us to shrug our shoulders. That's going way back to genetically. That's just a thing that we do in response to stress, just like you see a cat's hair stand on end when they're stressed. That's the same thing with us, except we shrug our shoulders, puts all that tension in the muscles in the neck there, and eventually, when you're like that long enough, you start to think that's normal. And you see all these people walking around with their shoulders touching their ears, and that's one of the biggest things when I have people laying down on the table. It's amazing. You have them. You just say, okay, relax your shoulders, take a deep breath, and their shoulders drop like 3 inches.
Really?
Yeah, it's really pretty interesting. So. Yeah, that's a big part of the chronic neck issues.
Stress, and you hunch up your shoulders, and then it becomes painful.
Eventually,
muscles stay in spasm, I guess.
That muscles stay in spasm, puts a lot of tension on your nervous system. It's interesting because there's a lot of studies out there that show the more tension there is on a nerve, the slower the nerve impulses fire through it. So the signal can't get sent as quickly as it should if you put a lot of tension on a nerve. So when we tend to be like this and our head's way forward, you're actually putting a lot of tension on the central nervous system and the spinal cord and all the nerves up there. And that creates a whole ton of other issues, because when you're dealing with structures that high up and nerve impulses that high up, they're responsible for a lot of other functions that can then be affected by that tension buildup.
Well, I think we're going to take a short break. I know they show some public service announcements, so we'll take a short break here for a few minutes, and then we'll come back with Dr. Phil here, talk a little more about chiropractic. We'll talk a little bit about maybe low back pain, which is important for everybody, and then some of the newer technology you have in your office. And I'm Dr. Gerry Spindel. We'll see you in a few minutes. Thank you. Hi, I'm Dr. Gerry Spindel, welcoming you back to Ion Health. Today our guest is Dr. Phil Szalowski, who's a chiropractor in Derry, New Hampshire, practices out of Broadway Chiropractic on Broadway in Derry, New Hampshire, right? And we were talking about the way you tend to treat patients in sort of a whole body method and their whole neurologic and musculoskeletal system. I'd like to focus in a little bit on low back pain. That's probably the most common complaint one of the most common complaints that you get. How do you tend to approach people who come in with back pain who may have been diagnosed with, a bulging disc or something like that, or people who've already had surgery whose pain recurring? So give us your kind of step through that whole process.
Sure. People that have a chronic history of back pain, that have diagnoses like that, whether it's a bulging disc or a herniated disc or stenosis, I love to see the images, first of all. Anything that they've had done before, I want to know about it, because I want to know what maybe did work temporarily or didn't work at all. So I go through that history, I look at all the images, and then I kind of tailor the treatment plan based on what's going on. On occasion, you'll get people that there's something going on that I'm not comfortable even working with, and that's very rare, but I want to make sure that I know what's going on, and I want to make sure that they're in the right place. And then if I find it is something we can help with, depending on the extent of the degeneration or arthritis, or how badly herniated the disc is, or how much stenosis there is, that's gonna change the type of treatment that I do with them. There's different adjusting techniques that I can use that, especially for people that have a lot of degenerative change in their discs, or discs that have worn out over time. There's a lot of techniques you can use that are a lot less, they're a lot more gentle. You're just trying to make sure that you're minimizing how much torque you put on those discs. You're not forcing anything where it doesn't want to go.
And what exactly, when you say torque, what exactly are you trying to accomplish when you do these manipulations?
Yeah, when I do an adjustment, it's basically trying to restore some of the normal movement to a joint that's lacking that movement. The way I'll explain a lot of times to our patients is, every joint in your body depends very heavily on movement to stay healthy. That's how your joints get most of their circulation, actually, is when you move, water and nutrients kind of circulate in and out. So a joint that's not moving properly is actually losing the amount of circulation that it should be having. And when it loses that circulation, it naturally starts to dry out, it starts to degenerate. So the more I can restore some of the normal movement to a joint, the healthier you can keep it in the long run. You know, so that's one of the primary things I try to do, is restore the normal movement to the specific joint that's restricted. The other thing I try to make sure is I want to make sure that things line up as good as I can get them. That means that things that have been in the wrong spot for decades, I'm not going to magically put back to where they're supposed to be.
You don't have an eraser?
No, that'd be nice. No, so I try to get them as good as I can. So, you know, let's say somebody comes in and they have a pelvic misalignment, where let's say one hip is a centimeter higher than the other. I use a lot of specific adjusting techniques to try and level those hips out. There's only so much change you can affect from adjustments. So if I need to, let's say, work on certain postural exercises, or sometimes I'll add a heel lift on one side to try and balance things out. Because the better aligned the foundation is, the better aligned everything else is. You know, and that's what we're trying to restore. So normal movement, normal alignment. Those are the two things.
And you can actually, I mean, the bones that make up the spinal column, the vertebrae, when they're actually encased in muscles and ligaments, and you can actually move them. Is that true?
Yes, that's what you're trying to do when you do an adjustment.
Right.
You're trying to move not just the bone, but the joint. You know, you're trying to get the joint to get some of that normal mobility back. Sometimes when the muscles that encase that bone are so darn tight that you can't even get any movement out of it whatsoever, there's different approaches that you would take to try and address some of those muscular issues, and then try to address some of the alignment issues deeper down. So,
how about, I know the old days, maybe not so old, they used to use traction for people's neck and things like that. Is that still something they do, and is that effective? I know for neck issues and things like that, they used to use traction quite a bit.
Yep.
Tell me a little bit about that. I don't know if you have experience with it, but I remember.
Sure. It depends on the patient. You know, actually, one of the offices I used to work at, we did a lot of traction. A lot of the stuff that I do now is more manual traction, where I'll use my hands, and I only use it if I think it's going to benefit the patient. If it's not comfortable, it's not something they're enjoying, I'm not going to force it. But the principle behind traction is you're trying to decompress the discs or the joints in the spine. Because if you think about it, we spend all day fighting gravity, and that gravity kind of compresses everything over time. And what you're trying to do is decompress it by doing the traction. I recommend a lot of home traction for people if I think they'll benefit from it. So things like inversion tables or inversion chairs, that's something that a lot of my disc patients, if I think they'll benefit from it, I actually recommend it for home. Because that's something you can do on your own too.
Is that helpful for backs and necks?
It can help, yeah. It depends on the person again, but it definitely, you know, it can help the right kind of patient.
I tried it once in a store. It's amazing. The pressure it puts on your ankles. It feels pretty strange.
Did you go completely upside down?
Of course.
Oh yeah. So here's what I tell people. When you
Start out slow.
Yes, yes. You want to, when you're doing that kind of stuff, you want to definitely start out at if you buy a brand new table or a brand new chair, it usually comes with a set of instructions on how to use it, and kind of incrementally work your way up a certain amount of degrees at a time, and also incrementally in time. You know, you start with 30 seconds, work your way up to a minute and 2 minutes. And really, you're not ever completely upside down. You shouldn't be anyway, because you don't want to
worry about getting stuck and nobody be around.
Yeah, passing out, that kind of stuff. Yeah, not great. So yeah, you want to make sure that's one of the things I definitely try to get people to.
So people could pass out in those things if they.
Well, you think about, you spend enough time upside down and you get enough blood rushing to your head. Yeah.
Interesting.
Yeah.
So you were telling me earlier you've got some new technology in your office for establishing the health of the nervous system and things like that. Can you tell us what that is and how it works?
I'll try my best. We're really excited about it because it gives us an objective way to measure function. You know, it's a way for us to measure how well your nervous system and spine are functioning, as opposed to just asking you how they're feeling. You know, there's a big distinction between those two. And it's Space Foundation certified technology. It's actually been employed by NASA in the past to test the effects of of space, of zero gravity on the musculoskeletal system, see how it affects the muscles in the astronauts. So it's pretty neat technology. And there's basically 3 separate technologies that we utilize in our office to assess function. And I usually break it down by the portions of the nervous system. So basically, if you look at your nervous system, only about 10% of it is dedicated to things like pain sensations, you know, hot and cold, pressure, those kinds of sensations. There's only about 10% of it that's of the nerve fibers that do that. The rest of it's divided into 2 main sections that, and I'm oversimplifying this, but I'm trying, you know, I try to explain it as simply as I can. But half of it is, the rest of that, half of it's dedicated to autonomic control, which is like all your organs and glands and those background systems that work, whether you're aware of them or not.
Keep you alive.
Yeah, that stuff. You know. And then the other half of the rest of that nervous system is dedicated to musculoskeletal control, so regulating all your motor function, your core activity, all that stuff. So the technologies help us measure. They don't measure where the pain is. I mean, you can tell us where the pain is, you know, but they help us measure those 2 other aspects of your nervous system: that autonomic function, all that background stuff, and the muscular function. So the first technology, it's basically a rolling thermal scanner. It measures temperature differences along the spine from bottom to top to make sure that your body's regulating that properly. Basically, the skin is the largest organ in the body. Right? That's how your body regulates temperature to make sure that you're maintaining your proper body temperature. So if there's large differences across your spine from one side to the other, it just tells us that that region of your spine, there's something that's interfering with the normal function. You know, it should be, when you're talking about a 2-inch span across the spine, the temperature should be pretty equal, pretty uniform. If it's not, there's something going on. That's a regulation issue. Your body's not being able to regulate it properly. So that's the one technology that we use. The one that's been used by NASA is the Surface EMG, which basically is a way to test muscle activity or muscle tension, basically at rest. So when you're just sitting there, we measure to see how much core activity you have, if there's too much or too little, if your body's, you know, really working way too hard to just keep you sitting there, or if it's not working enough, if there's too little activity. And they're basically, the sensors basically just pick up on the electrical activity in the muscles. That's how muscles contract. When your nerve sends an electrical impulse, your muscles contract. That's what tells them to move. Right. So that's what those sensors are picking up on. And the third one, which is probably the hardest to explain, but it's the most interesting. It deals with heart rate variability. So it basically, big word, but it basically helps us to measure how well your body copes with stress, how adaptable it is to stress. And it does that by measuring there's slight fluctuations in our heart rate. When you're just sitting there, your heart rate's constantly changing and your body's regulating it to keep it within a certain range. And how well it does that gives us an idea for how well your nervous system can regulate overall function. And we basically, that's what we use it for. We use it to see how well it adapts to stress, and not that we stress people out while they're there. You know, you stress yourself out plenty. I tell people I don't need to stress you out anymore, and see how adaptable it is. You know, see how much it can, see how much reserve it has to stressful situations.
So these are the 3 parameters you measure.
Yep.
And then through that you formulate a treatment plan, a detailed treatment plan?
That's part of what we weigh in to see what kind of treatment people need. The nice thing about the scans is they give us something to remeasure because we do re-exams periodically with people to try and make sure we're headed in the right direction. So those scans give us an idea for how well we're affecting changes in overall function versus just asking you how you're feeling, you know. And I certainly ask how people are doing, how they're functioning at home, you know, if they can do the things they weren't able to do before. But actually being able to measure it quantitatively it's nice to have that tool. And it actually gives us a scoring system to just break it all down to numbers so that you can see where you scored in each of those 3 parameters on a 0 to 100 scale, and it gives you a goal. You know, if you're in the 70s, you want to move up in the 80s next time, and get to remeasure and see how well we're doing when it comes to that.
And you've had this technology for how long?
We just got it beginning of this year, so in January. We just.
And the response from patients has been?
They love it. I mean, it's awesome to have that tool to be able to visually see where you're.
It's like checking their vision on a chart.
Yeah, exactly.
You can see how they're doing. Gives
Yeah.
you an objective way. Have these scans been tested in studies? I'm sure they've done some sort of
Yep.
studies on them to see what they
Yeah.
really mean.
Yep. There's actually, especially with the surface EMG, like I said, that's utilized by NASA, and then you have the heart rate variability scan. That's actually being used in some cardiologists' offices are using that to assess just for heart health, heart function, along with a lot of other tools, obviously, that they use. But it's definitely not just limited to the chiropractic field as far as what it's used. The way we interpret it might be a little different from the way they interpret it. They look at just the heart function, but it's interesting because your nervous system is regulating that heart function, so it gives us a little bit of information as far as how well that overall function is going. And there are some interesting studies as far as overall health and how heart rate variability plays into that. And there's also studies that actually show how chiropractic has a direct effect on heart rate variability and how well your body regulates heart rate.
So give us some take-home messages. We're coming to the end of our show. So give us some take-home messages for people who are out there who interested in chiropractic and alternative methods of treatment and things like that. Things, posture, workstations, things that we do every day, work at the computers, the things that we do 99% of the time.
Yeah, yeah.
Most of the time I'm not laying on the beach and, relaxing, so.
Yeah, that's probably the biggest thing is the stress thing. But, as far as real simple take-home things, I'm always trying to focus people on their workstation setup because that has a big role on how much stress you're putting on your spine and your nervous system. So
let's talk about that a little bit. So
yeah,
take us through workstation setup. What is the optimal workstation setup?
Optimal. There's an optimal, but there's no great way to when you're sitting for that long at a time. There's it's just our spines were never intended to be in that position for too long. So
sitting.
Yeah.
Better standing.
Yeah, much better standing, moving, walking. That's what they were designed for. The sitting actually takes out the curve, and there's 3 curves in your spine. In the neck and lower back, they both curve kind of inwards, and in the mid back, it kind of curves forward. And when you're sitting, what it does is it actually takes the curve out of your lower back. So it straightens your lumbar spine, your lower back, and it puts a lot of strain on the discs and the joints and the muscles because it's in an unnatural position. You keep it that way long enough, and then when you go to straighten back up, all of a sudden everything's like, no, you don't. And that's why you get that slow, kind of have to take your time to get back into a standing posture. So when you're sitting, you want to try to really be aware of having something, whether it's a lumbar support or a pillow or something, just to keep your lower back forward, so you're not rounding out your entire spine. Couch is the worst example. It's the perfect example of the worst position. I
know. I can't sit on the couch.
Yeah, it's not good, especially if you're there for a long time. And that's because it rounds out your spine. Right. So if you are going to spend any time on a couch, I try to encourage people to jam a pillow back there or something just to keep your spine more upright, keep that curve.
Sit at my desk, I use a Swedish kneeling chair.
Oh, do you? Yep.
Yeah. For years and years and years.
Yep.
It keeps your pelvic tilt, right?
Yes.
In place, and then your curve in place.
It helps a lot with that. Yep.
Of course, it's recently started to bother my knee.
Yeah, that's the catch. Yeah, that's the catch. Yeah.
So last night, I couldn't move my knee. I said, okay, that's great. Now I fixed my back, but I can't move my knee.
Yeah, that's how.
Are you a proponent of that kind of stuff that keeps your pelvic tilted and things like
yes.
that? I have my exam chairs are like that also. They're adjustable to keep that pelvis forward. Yeah,
that's a big part of it. You want to keep that curve there. But that being said, again, that position is just in a sitting position. You spend too much time there. It doesn't matter how good the position you are in. So the best thing you can do is get up. Every half hour, 5 minutes. 5 minutes out of every half hour spend on your feet.
Yeah.
And another thing that I try to get people to do is alternate maybe between 2 different types of chairs, or maybe an exercise ball and a regular good desk chair, you know, sitting on one of those big physio balls. And you don't want to sit on that all day, but it's nice to break it up a little bit and sit on that and then rotate it back and forth. So those are the kinds of things that I try to switch people up
I think
on.
driving is a problem also. I find certain cars I just can't sit in.
Yeah, certain cars are definitely worse than
I sit
others.
real well, and you know, you can sit upright in an SUV. You feel much better when you're sitting in a low car. It's like a couch.
Yeah, exactly. Yeah, when your hips are tucked up, and you want to make sure that your angles are open. You know, you never want to be sitting in a car where your knees are above your hip line.
Is that what it is? Your knees get above your hip line?
Yeah, because when you do that, you shorten a lot of the hip flexors, and that actually pulls down on your spine. So then again, when you go to get out of the car, everything's in spasm, pulling on your spine, and it has a tough time straightening back out. So.
How about neck position sitting at a computer? You know, do you recommend the monitor be straight at the height of the eyes? People are not doing this the whole time, or what do you?
Yeah, actually, this kind of plays into your field a little bit. There's you want the top of the monitor to be at eye level, so that your
top of the monitor at eye level.
Yeah,
okay.
So that because you do want a slight downward angle to the monitor. And that's not necessarily just because of your neck positioning, but that's actually for your eye health too, because that minimizes the exposure. I think it's the cornea, or how much of that is exposed to you know, the environment. So if you can minimize that, it actually helps with eye fatigue. And if you're helping with eye fatigue, you help with neck fatigue. And so that's a big part of it, is the proper monitor positioning. Laptops are my arch nemesis. Laptops are brutal. I try to get people to put the laptop up on some books and plug in a keyboard and a mouse, so that you're not using the mouse on or the keyboard on the laptop.
So I'll give you a little pearl you can pass on to your computer patients having trouble. The biggest problem with computers is that people don't blink enough. They stare, and their corneas dry out. And when that happens, their vision fluctuates, and they get eye fatigue and everything else.
There you go.
There you go. So the best thing to do is
more blinking
and put some artificial tears in, and your patients will all be cured.
Awesome. That's good to go.
This has been a great show. I always learn a lot from the doctors who come on with me. It's amazing, you know, how much I don't know. And I learn from other specialists, because we can't know everything about every specialty. But it's been great. So I want to mention again that Dr. Phil Szalowski, who's practiced in Broadway Chiropractic in Derry, New Hampshire, and you probably have a really good website, broadway-chiro.com. You're also on Facebook, right?
Yep.
Broadway.chiropractic on Facebook, something I know nothing about, but you probably do. And we appreciate your tuning in to here, Eye on Health today, and we promise to be back soon with other local healthcare experts, and we wish you to have a great weekend and a great holiday season coming up. Thank you.